Welcome to episode 371, where I'm speaking with Dr. Nammy Patel about her passion for Ayurveda and holistic green dentistry. We discuss the vital connection between our dental health and our whole body health, and why mouth breathing is so problematic. Dr. Patel gives lots of advice, including the best morning and evening dental routine. So please stay tuned. Hi there, I'm your host Colette, and on this podcast I will be sharing the teachings of Ayurveda, yoga, and holistic health practices. Now, if you're new to Ayurveda, I recommend checking out the first couple of episodes where I do an introduction to Ayurveda and the mind-body types. Thanks for listening, and now here's a new episode. Hello and welcome back to the Elements of Ayurveda podcast. I am very happy to welcome Dr. Nammy Patel, who is a graduate of the University of California School of Dentistry. Dr. Patel is a champion for her patients, fellow dentists, hygienists, and team. She was one of the first people to put forth the movement to bring eco-consciousness into the dental world. She specializes in green dentistry, a holistic, functional, Ayurvedic approach to dentistry. Dr. Patel is an expert in her industry, and she is a published author and leader in the field. She believes in supporting her community of patients, dentists, and hygienists, helping others recognize the vital connection between dental health and whole body health. Dr. Patel is a mentor to many dentists and hygienists all over the world. She supports the American India Foundation and has her own nonprofit, serving over 3,000 villages per year. Her goal is to save 1 million people from oral cancer in India. Dr. Patel supports many other local, national, and international organizations, because she understands that investing in worthy causes improves the world for everyone, including you. Dr. Patel, it is such a pleasure to have you on the podcast. Thank you for joining us today.
Oh, I'm delighted. Thank you for having me here.
Well, as I just mentioned to you before we hit record, I've been wanting to have this conversation. So I'm very happy to delve deep into the Ayurvedic approach to dentistry. But first of all, what I'd love to know is, why did you choose the direction of a holistic functional approach to dentistry? And why is it important to you? Why are you passionate about this?
You know, Colette, I grew up in India. I was born in my own house in India, where I have trees in the front, trees in the back, trees on the sides. Literally 8 houses is really where I was born, in my living room. And I've always been raised with mindfulness, and also definitely come from generations of Ayurveda and holistic health. And then we came to the US when I was 5 years old. So I did majority of my primary schooling and things like that, but I never left my roots. My roots, or my way of living at home, is very, 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 holistic. And I also am Jain. Jainism is a religion that it really gives, the number one thing is nonviolence. And also when we think of nonviolence, we actually think about, harming our bodies, harming our environment, harming other people, and just being really mindful of our interactions and everything that we do, and really adding a lot of depth through our life. We hear this word called, or this buzzword of sometimes, purpose-driven life. I was actually raised to live it. I was really raised to live a purpose-driven life in everything that we do. And so it's kind of in my blood. It's kind of been the way I have been raised. It's in my DNA, for lack of a better word. So when I got out of dental school, I was just heartbroken. I really saw dentistry, and I saw it was just a drill and fill and this little machine. It was a loop, and there really wasn't It wasn't preventative, which was my biggest concern. There was a ton of waste that existed. There was no communication. There was no mindfulness. There was no holistic approaches, which were really needed and necessary and are available because I grew up with them. So when I got out of traditional dental school, I was like, you know what? I really want to change this industry and I really want to serve my patients in a different way. And so I started my own practice. I call it green dentistry because there's so many factors that I take into place. Now, there is eco-consciousness, which is we are a LEED certified practice, so leaders in energy and environmental design. The way that the office is set up, nothing off gases. We don't use toxic chemicals. Even the materials that go inside the mouth don't off gas, decrease and increase hormone levels, which is really awesome. We definitely don't place mercury. We do a lot of different things that are eco-conscious. Beyond that, what I've really wanted to do was really create a wonderful relationship between patients and the doctor. So it wasn't this like get in and get out 5-minute conversation. It really is every person comes in. We look at data testing. We look at, hey, what is your genetic risk for inflammation? What are the specific bacteria that you have in your mouth? Can we help you prevent heart attack, diabetes, cancer, Alzheimer's, arthritis? And then we have data driven information that we utilize and then we add in the Ayurvedic holistic modalities to be able to cure any disease and dysfunction. That's number one. And really what we like to do is data test it again, because again, science has proven information that Ayurveda has known for generations and 5,000 years, and just for a very long time. It's utilized herbs instead of pharmaceuticals to be able to cure disease. And it really works. And it's really awesome to take data and, combine like the Ayurveda and also holistic background with science and really show that to patients, because even if they're not interested in the holistic aspect, they really love to see the results, because it gives us this sense of confidence, right? When we have a lab test that tells us like, this is the bacteria you started with, this is what you look like now. And we've done that without antibiotics. It's really wonderful for patients to feel that sense of confidence. And also it starts them on a sense, on a health and wellness journey, which I really, really, really love. And it makes me feel very impactful. So, that was a long answer, but I love what I do, I guess is what I can say.
I love it. Long answers are great here. And I can hear your passion and how you've encompassed everything from growing up in India, from the, all the experience you've had, how you live at home, your spiritual beliefs, and bringing all that with your studies into your practice is just amazing. It's your dharma.
It is. Like, right? It is. It is my karma and my dharma. Yes, absolutely. I definitely feel like I was put on this planet for a purpose, and then I'm going to digress here a little bit, but I've never wanted to have children for some reason. I thought that like the world is my children, like my patients are my children. Like I'm here to grow them, help them, support them. And I call it my living legacy, because, I want to live my legacy every day versus, having something when I pass away or whatnot. So it's really fun.
Yeah, you certainly are making such a difference in the world. It's great. And so we know that Ayurveda understood holistic health 5,000 years ago. And somewhere along the way with modern medicine, reductionist medicine came into play. Now it's reversing course, which is a great thing. But what do you want people to understand about that vital connection between their dental health, their oral microbiome, and their whole body health? And maybe start with talking about the oral microbiome as well, so people understand that, please.
Sure, absolutely. So the first thing I always like to tell my patients is that, listen, your mouth is related to the rest of the body. It is not a separate entity. We're connected. That is number one. And then, the other thing I always like to say is we're also quantum beings, right? Everything is connected. We're interconnected in so many different ways. And so the first thing we look at is neck and up is dentistry. As a dentist, I have my license, which allows me to practice and really look at all structures from neck and above. And so there are two major ways where dentistry is really critical to overall health. And the first one you touched upon, which is amazing, is the oral microbiome. Now, looking at the oral microbiome, we now know specific bacteria that will cause heart attack, diabetes, cancer, Alzheimer's, arthritis. We know them. We can get rid of them without using antibiotics or use of lasers and, different organic materials. So that's our first step that we look at. The reason we look at that is because your mouth, you swallow 5 gallons of bacteria every single day. Let me repeat that. 5 gallons. So when you have pathogenic or bad bacteria that's in the mouth and you swallow that, it's going to go into your gut. Now, if it goes into your gut, your immune system is shot. It's just gone because from the gut, they break through the enteric lining and they have access to the bloodstream. From the bloodstream, these bacteria are so small and so pathogenic, they can cross a blood-brain barrier, and that's how they're related to Alzheimer's. And so when they go into the bloodstream, your body tries to fight them off. As it tries to fight them off, it actually combines to cholesterol, and it actually makes your blood vessels stiff. And so that's how it causes heart attacks. It also is known, these specific microorganisms are also, when they go into like the cells, they actually change the cellular DNA and make tumors grow. A lot of times we see patients with like PCOS or any sort of low grade benign tumors, even cancer. We can actually diagnose that through the mouth, which is really interesting. And then when we look at these specific bacteria, they have a tendency to attack the beta cells of the pancreas, which we know is related to diabetes because the beta cells control insulin. And even arthritis, some of the bugs are so small that they can cross through the barriers that we have. Kind of like COVID, the reason why we got COVID was because COVID, our immune system wasn't set up to defend ourselves against COVID. And so what happens with these bacteria, they're so small. We have these membranes that are supposed to keep the bad bugs out. But as a membrane breaks down, it actually gets into small spaces like our joints. And that's how it's related to arthritis. So there's scientific evidence. We can go down to tumor necrosis factor alpha, which are like traffic lights, basically, that they are triggered to do damage in our body. So these bacteria are there. They're not supposed to be in our system. When they get in our system, our immune systems get hyperactivated. As our immune system gets hyperactivated, they're fighting these bugs up. But as they're fighting these bugs up, they're also damaging our healthy tissues. So that's how it really puts the system in a hole from a science perspective.
Okay. Thank you for explaining that. So these bacteria in the oral microbiome are safe in the oral cavity, or are these external bacteria that we're ingesting and that are problematic everywhere?
They're problematic everywhere.
Okay.
And so the biggest thing is, we used to think that disease was from belly up. But Ayurveda has known for generations and 5,000 years, even beyond that the breath work and the disease is from mouth and nose down. The reason I say that is you asked me the first question, which is, hey, how is dentistry related? Tell me more, right? One is the oral microbiome, which is one thing we've touched upon. We now know the specific bacteria. Now we've got to look at how do they get there, right?
Exactly. That's my question.
So yes, absolutely. So now if we look at the number one reasons nowadays, and I'll talk about, how it used to happen in the past. Nowadays, it actually happens is because majority of the people are mouth breathers. What has happened to our society is that there are so much pollutants that are out there. There's also interventions with braces, which doesn't allow the sinus cavity to grow the way it needs to grow. So it really, and then also evolution wise, as we were, our ancestors were closer to the grounds, right? We come from, gorillas and whatnot. So our sinus cavities used to be really big, but as we've evolved, what has happened is our sinus cavities have become smaller, but our heads have become really, really, really big because we're utilizing them. Look at the world of AI. We're using our brains so much that it's really a tissue, right? The more you use it, the more it's going to grow. And that's essentially what's happening with evolution. So the other thing that's also contributing to mouth breathing is also children are not being breastfed that they used to be. In Ayurveda, breastfeeding is encouraged, and now we call it colostrum, but we knew that the baby's immune system was going to come from the mom. So there were so many practices that were already being done that Western culture has kind of pulled out as the women went back into the workforce. When breastfeeding doesn't happen, the actual tongue doesn't actually get activated. So when the baby suckles on the breast during breastfeeding, it actually signals cellular signals to your sinuses to grow and make sure that you have a functional airway. What we find is patients who have not been able to have breastfeeding, what happens is that their sinuses, again, are really slow. Their tongues are not strong. So that muscle is collapsed, which really makes your functional airway very, very, very small. And even the addition to pacifiers and thumb sucking, all these things have really, really messed up the way that we actually naturally grow. What happens is thumb sucking, when the thumb is being sucked as a child or the pacifier is being utilized, it doesn't stimulate the same mechanism as breastfeeding does. Because when the breastfeeding occurs, your tongue has to work harder. When it works harder, that's when that pressure is what activates the sinus cavity to grow properly, the tongue to become stronger, and the throat and the neck to develop properly.
Oh, very interesting.
Right. And when all of those things are not done, what happens is that we can't breathe right. The reason we want to be able to breathe through our nose is because there is this one molecule that is so critical to overall health. It's called nitric oxide. Now, nitric oxide is actually made, you breathe through your nose, and in your sinus cavity, there is a synthase, a specific chemical. What that does, it converts the oxygen into nitric oxide. And nitric oxide helps you fight disease and dysfunction. And if you have any idea, or if there's any question in your mind, like, hey, wow, whoa, my God, breathing is so important. Our ancestors in Ayurveda, what is the number one thing they tell us to do? It is called prana. Mm-hmm. Prana is breathing. Now we breathe, breath work has been a really everyday component of life for such a long time. And prana is when we're breathing through our nose. Meditation is that. When we're breathing through our nose, we're activating nitric oxide. And that nitric oxide is actually working towards our entire body. It helps prevent heart attacks, diabetes, cancer, every disease that exists. Nitric oxide actually helps you fight that off. And that's why nitric oxide is really important, which our ancestors already knew because they focused on prana, the breath.
Okay, so one of the ways that bad bacteria is getting in is airborne.
It is airborne. So what happens is that, so we now have learned that, our sinus cavities have become smaller for so many different reasons. So we're not breathing through our nose, we're breathing through our mouth. So when we breathe through our mouth, what it does, it creates a dry environment. So when there is a dry environment, it makes bad bacteria overgrow. So the analogy I always like to use, Colette, is like, think about it. Where does fungus grow?
In damp environments.
Exactly. So this is the opposite. This is dry environment. So when we're mouth breathing, and you can try this, take a breath through your nose, right? And then now take a breath through your mouth.
Yeah, you can feel it instantly, the dryness.
Exactly. Now that dryness consistently utilized is going to make the mouth super dry. When that happens, what it does, it makes bad bacteria overgrow. Those bad bacteria are the ones that cause heart attack, diabetes, cancer, Alzheimer's, arthritis, all the things we've talked about. So that mouth breathing is horrific. It is the worst thing for dental health and overall health. So that's, one of the biggest piece that we focus on in holistic dentistry is really making sure, number one, let's look at your oral microbiome. And then let's also focus on making sure we prevent the root, which is mouth breathing. And now the other thing about mouth breathing, and I'm going to tie this back a little bit to Ayurveda as well, is, mouth breathing isn't the reason why it's such a big concern for overall health as well is it actually causes anxiety. It actually causes gut issues. It actually causes depression. It also is, a lot of times ADHD is also caused by all of these things. Now, the reason why is because you're not getting that molecule nitric oxide, which is what we really need. And then nitric oxide, when you're breathing through the nose, what the body is doing in the breath, right? The breath work, as we hear in Ayurveda, the breath work is really a component for helping us manage our stress and our anxiety. Where, one of the things that they tell you when somebody has a panic attack is what?
Breathe deep.
There you go.
Mm-hmm.
And not just and it's deep breath, belly breaths, right?
Yes,
so when we're getting that functional airway activated, it is activating our vagus nerve. It is activating our rest and digest systems. It is activating healing. And that is so important. What I'm so curious about is like, I don't understand how we can put people on the moon, but I don't understand why they don't understand the mouth is related to the rest of the body.
I know. Yeah.
And for hundreds of years, right? Not just now, but hundreds of years. And Ayurveda knew this from such a long time, which is amazing. It's been amazing that Ayurveda has known this. And I'm so blessed. I feel like my learnings, I started yoga when I was like, 6 years old or, something like that, because I went back to India for boarding school. So it was really awesome to be able to even understand how utilizing our bodies in different forms and utilizing yoga, breath work, how we can really stimulate healing. We can also stimulate our bodies to be our own, our own pharmacy, really.
Absolutely. Absolutely. And I'm interested with the mouth breathing. I have heard a podcast on this before and how important it is to breathe through our nose, particularly when we sleep. So do you recommend mouth taping?
Absolutely. I absolutely recommend mouth taping, but I am really specific on that. So this is a way I recommend, how I recommend a nighttime ritual. So the first thing I always say is that shower before you go to bed. The reason why I say shower before you go to bed is because you're taking off all the toxins. So any sort of pollutant, any sort of allergen that is on your body from all day being out or whatnot is shower. You change your clothes, obviously, so that all the toxins are out. You actually open your sinuses because when we shower, we're always taking our boogers out, right? We clean them out. So we open up that airway. So mouth taping is more effective when you are able to make sure the sinus is really clean. Now, if the sinus is not clean, I recommend using like a neti pot. You can use a ghee or oil in it, and it helps lubricate the sinuses. And especially if you're living in an area where it's cold and rainy or whatnot, the air tends to be a little bit drier. So that oil really helps make sure that the sinuses are lubricated. And when the sinuses are lubricated, they're going to stay open longer. And then you can mouth tape.
Okay, great. Okay.
Yeah.
Yeah, I personally have been mouth taping for a few years and I can't do without it now. It's kind of weird when people hear about it first, right? They're like, what do you mean you tape your mouth shut? But can you explain to people exactly what you mean when you talk about mouth taping?
Yeah, absolutely. Yeah, absolutely. So the first thing I always say is try it out. So mouth taping, what we actually do is put a tape around the mouth and, you can get one off of Amazon. The cheapest one is completely fine. You don't need anything fancy or anything like that. So like I said, shower first, open your sinuses, put the mouth tape on and go to sleep. And it may take you a day or two to get comfortable with it. If you find after a week that the mouth taping is very uncomfortable, it's really important that you see a dentist or a medical doctor because you might have some deeper concerns and your tongue may not have enough space. So we definitely want to look at that. So I want to mention that first. But mouth taping is actually really easy. You just take a piece of maybe about an inch or two. And I personally like to use it vertically underneath the tip of my nose. And I just put that vertically on my lips and I go to sleep. And it's really great because the tape is not too tight. It does have a little bit of give just in case your airway or if you're congested and you need to open your mouth to breathe a little bit or whatnot. So we want to make sure it's safe. So you put the mouth tape on and you just get to sleep. In the morning, you wake up and you take the tape off. It's super easy. This by far allows you to breathe through your nose. So if earlier we tried an exercise through breathing through the nose, and then breathing through the mouth, how different that was. What I'm going to have you do now is take your hands and block your nose. You're naturally going to open your mouth.
Right.
And so if we tape the mouth, you're naturally going to be forced to breathe through your nose, which is really nice.
Absolutely. Okay, great. And this is why, a lot of people wake up with, when I'm doing consultations, they're talking about, I wake up with a dry mouth and very thirsty, but a lot of that could be due to mouth breathing, right?
It is. It's due to mouth breathing. The other thing that I want to mention is a lot of the dry mouth is also related to number one, a lot of people tend to be on anti-anxiety medication. So that is the number one reason, even inhalers, because of so much allergens in the air. So they actually, steroids will also cause dry mouth. All of those things will cause dry mouth. And so mouth breathing is one of the major reasons why patients have it. Now, the thing I always say is mitigate the dry mouth. And what we can do is before you go to sleep, before you put on, remember I talked about the nightly ritual? What you can do is some oil pulling.
Yes.
You can swish your mouth out with some coconut oil. So if you take some coconut oil, what you can do is swish your mouth out. And what you do is you just swish for about 20 minutes. And then make sure that you do not put the coconut oil in the sink because it will harden. Put it in a trash can. But what that will do is pull out all the toxins. I like oil pulling for two reasons. Number one, it's going to hydrate your mouth, which is awesome. The second is it's also going to pull out a lot of toxins out of your body. For example, so the tongue is the most vascular organ that you're going to have. So what it means by that is that when you have your tongue, as you swish around for 20 minutes, you're stimulating blood flow. When you're stimulating blood flow, your body is designed to keep that coconut oil actually will pull out bad bacteria, toxins, even fungus. Believe it or not, coconut oil has a natural fungicidus property, which is amazing. It will pull out things out of your body. This is systemic, which is really awesome. And 20 minutes is a good amount of time to, really get good amount of circulation going through the body and really pull out a good amount of toxins. So it's like a chelation agent. A chelation agent is a binding agent.
Okay, great. And so you recommend that evening and or morning?
I recommend evening personally, mainly because, time is a constraint, right? We're in a modern society. We're busy. And I like that part of our nightly ritual because you get a bigger bang for your time, right?
Yeah.
So if you can do them oil pulling, it's going to hydrate the mouth and it stays in your mouth the whole night. Then you mouth tape. I mean, you just get so much more benefit out of the time that you've utilized. So I find that to be more effective, and I'm all about effective and efficiency. So.
I hear you. Absolutely. And it's great to do, like if you're having that evening shower, to put the oil in your mouth while you're having the shower and you're a little bit of multitasking going on. Okay. Multitasking.
Exactly.
And so I understand the coconut oil, obviously antibacterial and many more anti-inflammatory if you have inflamed gums and so on. So that's beneficial. Do you recommend sesame oil as well? Because sometimes sesame oil is recommended.
It is. So, what I always say is I like to alternate. So sesame oil is really great for the gums, because it does help rebuild gum tissue and the collagen inside it. So I would say this is my go-to. So if I have time, because sometimes we're rushed, let's be honest, right? We have a lot of things going on. So sometimes you may have a late meeting or you may get home late and you may not have the full 20 minutes to do the coconut oil or the oil pulling. So what you can do on those nights is take the sesame oil and rub it on your gums. And that also helps stimulate. Again, it's doing the same thing. It's stimulating collagen. It's stimulating blood flow. It's helping your gum tissues become stronger. And it works really great. So I always say that, hey, either way, you're getting the hydration, sesame oil or coconut oil, which is fantastic. And then what it's doing is that we're adapting things so that it's more useful for our lives, right? Because that's what we need is we need a couple of tricks up our sleeve, right?
Exactly.
Because things aren't perfect always. So.
That's great to know. That's a great tip. And so does the sesame oil, when you say rebuilding tissue, does it help with receding gums?
It does. Okay. It's designed to help with receding gums, because it helps stimulate collagen fibers. So that is the main reason for sesame oil. And it also helps thicken up the gums, which is one of the biggest reasons for sesame oil. And it's been, again, used in Ayurveda for thousands of years.
Absolutely. I'm going to jump in here because I wanted to let you know that my next discounted group cleanse is starting January 31st, 2025. It's a great way to start the new year, taking care of your health and well-being. This group cleanse comes with a 90-minute online consultation with me so that I can check in on your current health status and then tailor the cleanse to you. Now, this is a holistic cleanse. So not only will there be recipes tailored to you, but also we're going to incorporate what we've just been talking about, which is the nasal cleansing, the neti pot, the oil pulling. We're going to be incorporating breath practices, yoga, lots of dinacharya, self-care practices included in this cleanse. And I tailor it all to your lifestyle so it doesn't become overwhelming for you. And this is a group cleanse. So we have a private community where you can connect with others on the cleanse, and it's great for support and accountability. If you would like to learn more, just click on the link in the show notes or visit my website, elementshealingandwellbeing.com. For the group discounted cleanse starting January 31st, go to the events page on my website. Now, if that date doesn't work for you, you can choose a private cleanse. It's the same structure, but you just get to choose your own dates and you have me one-to-one for support. You'll find the private cleanse information under programs. So I hope to connect with you in the new year and that you start the new year taking care of your health and well-being. Okay, let's get back to my conversation with Dr. Patel. Okay, so we went off on a bit of tangent, but all good because I want to ask questions as I think of them. So now I'm going to bring it back because we were talking about how the bad bacteria get into our system and cause all sorts of problems. And we discussed mouth breathing. Was there anything else that you wanted to cover there?
Yes. Well, there's one more thing. We talked about bad bacteria. I want to kind of tie the overall health into place. Okay. So, as a dentist, I not only look at the microbiome, I look at your functional airway. And the third thing I actually look at is vitamins. And the biggest one that I look at is actually the amount of sunshine we get, vitamin D, right? Mm-hmm. So vitamin D is really important because vitamin D is a precursor to so many different hormones that we need, testosterone, estrogen, acetylcholine, just so many different things, right? So that is really important to take a look at. The other thing I like to look at is vitamin B12, which is really needed for our neurology, which is really needed, especially as we're living so much longer too, right? I feel like we're going to be living till 150 or our consciousness are going to be ascending. I don't know with all the, I mean, I live in San Francisco, so we have like self-driving cars. I'm just fascinated.
Exactly. Well, the outlook on longevity and the focus on longevity now, it's definitely a goal for many people to help us live longer.
Yeah. And with our marbles, right? We want to have we want to have we want to live and we want to live well without disease and dysfunction. So, so vitamin D, again, vitamin D, vitamin B, and then, the B50s, so looking at the 12 vitamin B levels, those are really critical because earlier I talked about, mouth breathing and nose breathing, and nose breathing and mouth breathing are all really important because they're part of sleep. Mm-hmm. So being able to get good sleep is really important. And it's the one thing that is also not being looked at by medical doctors. It's not something that has been, not being addressed. The reason why we need to sleep is because that's when our body heals itself, right? So our bodies are able to take inflammation or our bodies are able to take disease. But we need some downtime so that our immune system can work. And we can actually make sure that our bodies are in the rest and digest portion of it. When we have the correct vitamins and the cofactors that we actually need for our nervous system to work properly, we're able to go into that rest and digest mode and again, fight disease and dysfunction. And, all of these things that we're talking about, it's not new. It's things that we've always heard in the past, which has been like, hey, go for a walk outside, right? We used to work out in the sun. Our worlds were where we sat outside or did field work or farming or things like that. But nowadays, we all kind of sit at a computer desk, so we're not getting out as much as we need to. And then vitamin D is the most deficient that I see in so many patients. And I see it, and it's really interesting. Their medical doctors won't diagnose it, but I'll be able to see it because I will see their bone levels. Mm-hmm. I will see their bone levels decreasing. I will also see big pulp chambers on their x-rays or on their digital x-rays. I also see implant failures. So I see a lot of these things that are, or like some patients get a lot of cavities because they're vitamin D deficient. So really looking at these things, which are really important, again, for cavities, gum disease, of course, but beyond that, to make sure that your body is working properly, to make sure you have all the hormones that you need that are functioning well. You are sleeping, you are resting. And there's a huge, earlier I said that we're quantum beings, everything's kind of connected. This is where I'm bringing everything is kind of connected into play here.
Mm-hmm, absolutely. I love the holistic outlook that you have. And so with looking at how these bacteria get in, we're talking about the mouth breathing. And then I think people are aware with gums, right? That's how bacteria get into the bloodstream as well. So the mouth breathing, the bacteria are getting in, overwhelming our agni, our digestive fire, causing problems there, and then traveling throughout the body. And then the other pathway, is that correct, is through our bloodstream if there's problems in the gums?
Yeah. So one is access through the blood as you floss, and then there's bleeding in the gums, right? That's one way. The second is salivary flow. So what happens is you swallow 5 gallons of bacteria. When you swallow 5 gallons of bacteria every single day, our microbiome is going to be unbalanced. And it's going to be even more unbalanced if you don't have enough vitamin D. So if you're not getting out in the sun, your gut's already messed up. Now you've put all these bacteria inside. You're swallowing. I mean, we have to swallow every day. So we're swallowing, and that the bad bacteria get inside the gut. And from the gut, what they start doing is start breaking the enteric lining. And when that enteric lining is broken, that's where it gets access to the bloodstream. Okay. And that's where it's most virulent, kind of like SIBO.
Yes. Okay.
Same aspect. These bacteria get in there and they have access to the bloodstream where they shouldn't, really, because we don't want them to be there, right?
Absolutely. And so you're picking up on these early signs of disease, like in Ayurveda, say there's 6 stages of disease. So you can see, as you mentioned earlier, some of these early signs of dis-ease in the body before anything has been picked up by a doctor or blood test. Is that correct?
Absolutely. I can look at a patient and diagnose them so many times. Just like, and I know in Ayurveda, we actually do the pulse and stuff, but, I'm actually some of the similar things that we look in Ayurveda, we look at symmetry, right? That's a first sign. We're looking at if there is puffiness in the eyes. That's telling us something. It's telling us how inflamed the body is. We can see it. And then when we see the tongue, we can see scalloping on the tongue. That tells us what's going on. So we can just see signs and symptoms right off the bat without anybody telling me. And it's so funny, Colette, I have to tell you this because, as a dentist, even as a holistic dentist, most patients don't tell me they have so many problems until I ask them. So I'll have, we have this entire medical history, and it goes through like, hey, do you have sleeping issues? Do you have any anxiety? Do you have any acid reflux? Do you have any gut issues? And it's like, oh, it's all normal. And I'm working with my naturopath or they don't really say anything about it until like I'm looking at their tongue and I'm like, I know you've got some issues here, so let's talk about it and let's see how I can be part of your team and help you achieve better results. Yeah. It's like, I can see the white coating on your tongue. I can see the scalloping, I can see the palate, how it's developed. It's got concavity on there. And so, I mean, I can see, and even when I'm talking to patients, I see their mouths open majority of the time, and you can tell right off the bat, and it can see these things right away and be like, hey, there's some things that we can work on here to help you live longer.
Yeah. And again, it's probably that they just don't understand that you are, understanding that holistic approach, that it's important for them to divulge everything so that you can get a bigger picture of what's going on. Right. You mentioned braces earlier when we were talking about the shape of our mouth. What are your thoughts on braces, Invisalign, things like that? Because obviously when we're changing the positioning of the teeth, we're also changing the cranial bone structure, correct?
Right. We absolutely are. So the number one thing I would say is no braces, especially if you're a child. I would say absolutely no braces and absolutely no teeth extractions. That's number one. We now have technology that we can actually guide the craniofacial development, which is amazing. We have these things that are called guides that the kids can wear about 2 hours a day and at night. And what it does, it actually helps develop. Remember I told you earlier about how the baby sucks suckles on the breast, and then the tongue works out and activates the sinus cavity grow, all that stuff. So we can now have appliances that help us stimulate that. And so we actually help patients wear appliances to be able to get that natural movement. And sometimes they don't even need braces anymore, which is phenomenal. Right. So that's really exciting. I'm so excited about that. The second piece is with Invisalign, if you're an adult, I would say the number one thing I see with patients who actually go get braces because they are worried about their teeth is that they end up with problems to about 2 years later. So they'll get Invisalign done. It looks beautiful. They're super happy with it. And then 2 years later, they're like, hey, I have anxiety. 2 years later, I can't sleep anymore. 2 years later, I'm like, I have TMJ problems. I'm ringing in my ears. I don't know what happened, Dr. Patel. And I'm like, well, let's backtrack. Let's figure out where that happened, because I would say for about 50 to 60% of the population, it's fine to get braces or Invisalign in the adulthood, but there's a lot of patients where it's not. And the thing is, we always have to do a CT scan and really look at the functional airway first. So if we see that the airway is compromised, braces is a no, hands down, no way. If we see that, the airway is fine and the movements that we're going to do is not going to impinge upon his tongue and it's not going to cause any problems, sure, that's fine. So the first thing we have to look at in adulthood is to make sure that, the tongue does not get squished. If the tongue gets squished, and you'll see that because you'll see indentations on the sides of the tongue. You can look in the mirror right now, go to your mirror, take a look and stick out your tongue. If there is little indentations on the sides of the tongue, that means the tongue doesn't have enough space and you've definitely got an airway issue. Okay.
And you mentioned TMJ there, which is like clenching the jaw, tightness around the jaw. Is that correct? Am I?
Yeah. So let me tie this back to, it's all, in dentistry, it's all about the tongue.
Right.
So the reason why in Ayurveda too, right? The tongue is really important because it controls so much. So now let's say you have you had teeth extracted and you had braces done and things like that. Teeth look beautiful. Great. But what happens is that it constricts the jaw, and it also, that's number one. And I'm going to get into the cranial bone movements in just a little bit too. So the first thing is it constricts the jaw, so it doesn't allow the airway to go. And the tongue is a muscle, so it's going to continue to keep growing. It's not controlled by the bone, right? It's not controlled by the bone. So what it's going to do is, as you become an adult, what happens is that you will not be able to, the tongue doesn't have enough space. So when you sleep at night, the tongue is going to do is it's going to collapse, and it can't suction on the roof of the palate. So when it collapses, it starts blocking your airway. So when it blocks your airway, your body, because you're asleep, your body is going to want to try to keep you asleep, and it's going to do something that's part of our autonomic nervous system, which is our skeleton, kind of like the knee-jerk reflex, right? If you hit your knee, the knee just jerks because it's our bone, right? It's an autonomic nervous system, kind of like your heart rate as well. So what's going to happen is your jaw is going to grind and move around to try to get that tongue out of the way while you're asleep. And so that's where the clenching, grinding actually comes from. And then over a period of time, you'll wake up with tiredness in your jaw. You'll also get ringing in the ears. All these things are from the airway, and TMJ always go hand in hand pretty much 80% of the time.
Not to mention probably tension headaches from that tension in the jaw.
Oh, yes. Well, the tension headaches, we talked about the craniofacial movement, right? If you get braces, what happens is it constricts the sinus cavity, and it constricts your nasal bones, but then your nasal bones are connected to your eye bones, which are connected to your brain bones. So everything is constricted, and it doesn't allow it to grow the way it needs to. So when it doesn't, we have a rhythm. Our bodies have a rhythm, just like we inhale, we exhale, and everything has a rhythm. When that rhythm is constricted for a year, 2 years, 3 years, 4 years, 5 years with braces, it has a massive impact, and it doesn't allow everything else to grow the way it needs to. When that happens, we hear a lot about tension headaches. Again, IBS is another one. Believe it or not, irritable bowel syndrome. It impinges the vagus nerve sometimes. Even the blood flow is really messed up on the temporal blood flow. So many different things like sleepwalking. Again, we talked about the anxiety, the depression, just so many different things that are, a result of the braces.
And do you recommend mouth guards?
I recommend specific types of mouth guards. If somebody needs a mouth guard, first of all, if you came into my practice and I saw any signs of airway TMJ issues, the first thing we would do is a sleep study. And we also would do like a CT scan.
Yeah.
Because when we do a sleep study, it really tells me it's not that you're just sleeping for 8 hours. I want to know, what is your sleep quality like? Are you waking up in the middle of the night? Also, are you like breathing through, having that deep, upper respiratory like effort, which is not what we want. We want the belly breathing, right? So all of those things we really deep dive into it and see what's going on. Secondly, we look at your CT scan. We look at your sinuses. We look at, are your sinuses open? Is there fungus in there? Which is so common nowadays, by the way. Fungus in the sinus and stuff. So we make sure that we look at the sinus cavity, make sure that they're open and they're not inflamed. Second thing we look at is your tongue position. Does the tongue have enough space? Is there concavity where the tongue can't latch and can't suction at the roof of the palate? Then we also look at the windpipe. How big is that windpipe? It needs to have a specific diameter in order for it to be healthy. And so when people get braces, when they jam the upper jaw together, it doesn't allow the sinus to grow. Now, if there are braces on the bottom teeth, what's going to happen is it's not going to allow the jaw to grow properly. If the jaw doesn't grow properly, the lower jaw, the windpipe, your lower windpipe will be affected.
Oh my goodness. Okay. Mercury fillings. So obviously they're a no-no nowadays. And what to do if you have mercury fillings?
Sure. So mercury fillings, the reason why we are not happy about mercury fillings is that mercury fillings are, what they do is mercury is a toxin, and especially when it's being removed. Also, when you're chewing, eating, things like that, little mercury vapors get released. And that when mercury vapor gets released, it binds to an amino acid called glutathione, which is part of your DNA. When it binds to glutathione, what it does, it tells your body that, hey, when you're supposed to make an apple, it will make an orange. So that's why mercury is so toxic and not what we want. It's, related to Alzheimer's. It's related to so many different things. And it's because it really messes our cellular DNA, because it binds to those amino acids that make up our DNA. Now, if you need to get them removed, the way that I would recommend that you get them removed is through the SMART protocol. And the SMART protocol is a really great protocol because what happens is we isolate the mouth and we isolate the tooth. And there's a copious amount of suction. There's also a lot of air. And what we are doing with the mercury filling is, personally, I tend to chunk them out. So I don't drill the whole thing out. I will take and make one incision and I will pop them out. The reason I do that is the more drilling you do, the more mercury vapor that will be released. So I tend to remove them that way. The other thing I would recommend is after you do the, mercury removal, I would take maybe a small, I would say maybe 1/8 of a teaspoon of charcoal with water. And I would do that about for 4 to 6 weeks, because what that's going to do is it's going to bind all that mercury that's in your body or anything that might have been released. And then you're going to poop it out basically. Right. Because the charcoal is a great binding agent. Just be careful when you take the charcoal. You can't do it with any sort of medications or vitamins 4 hours before and 4 hours after. Because charcoal will bind to everything. It'll just pull everything out of your system. So.
Okay. Now that you mentioned charcoal, is charcoal safe to use on the teeth?
It is. Charcoal is fine to use on the teeth. Just like I would just say, I wouldn't use it every single day. Charcoal is great because it does whiten your teeth, which is awesome. But, in all honesty, you don't need something as abrasive as charcoal to be able to whiten your teeth. If you use an electric toothbrush and you brush your teeth for 2 minutes, it's naturally going to removing the stains. So it's, charcoal is great. I use it for maybe once a week, twice a week to help brighten your teeth and things like that. You don't need it every single day. And also, you also want to watch how much you do between oil pulling and charcoal. There's too much stuff going on. Let's simplify, because too little is bad, but too much is way bad, right?
Yeah.
So again, we got to stay in the middle ground, and we've got to be thinking things through and really looking at interactions and really looking at how things are working. So if you wanted, I would just say twice a week is usually more than sufficient to keep your teeth nice and white. But most importantly, even more than the charcoal is really If I had a choice of charcoal or oil pulling, I would choose oil pulling because it's more systemic and gets everything out. And instead of charcoal, get an electric toothbrush. That electric toothbrush will make a massive difference for you.
Yeah. Now we did discuss the evening routine. Let's discuss like the morning routine about you're using an electric toothbrush. Like what about flossing? What about do you rinse? That stuff.
Yep. Yeah, I usually, flossing, I also recommend, how we talked about being in the shower. So I would say so let's start with let's finish up the nightly routine and we'll come to the morning routine. Nightly routine, shower, open up your sinuses, floss your teeth, brush your teeth, oil pull, mouth tape, sleep.
Right.
Wake up in the morning. I brush my teeth with an electric toothbrush, scrape my tongue. And you have to do that. Obviously, scraping your tongue is anytime. Actually, you got to do it in the morning and at night because what we build is a biofilm on the tongue. So that scraping your tongue is really important because it removes all the toxins and it removes a biofilm of bacteria. So you want to do that actually morning and night. So let's start again. Actually, let's start with nightly routine is going to be floss your teeth first, electric toothbrush, scrape your tongue, then oil pull, then mouth tape and sleep. Okay. And then in the morning, you can brush your teeth and scrape your tongue and then be ready to go out. So that way, because we're all kind of in a rush in the morning. And also, if you have a couple extra minutes in the morning, spend the time to set your day up. Be mindful, set an intention, do some gratitude, 2 minutes of gratitude. And really setting your day up for success, because that is going to make a big difference on your overall health is when you are feeling good, because when you're feeling good, your immune system is in great shape versus when you're stressed out.
Yeah, morning mindfulness is really important. Okay, great. And after you brush your teeth with the electric toothbrush, are you rinsing?
You know what? I tend to, let's see, at night you're oil pulling. In the morning, yes, I'm rinsing.
Okay.
Yeah. The only time you wouldn't rinse, would be like if you had, there's some patients I do recommend don't rinse out on. And I usually like to use a hydroxy nanoapatite toothpaste. So no fluoride. Hydroxy nanoapatite is a natural, it's calcium, basically calcium carbonate. So that's really great for patients who might have like sensitivity, or maybe have a lot of gum recession. But for a routine person, if you're natural, if you're healthy and just you want good practices, I rinse my mouth. It's fine.
Okay, great. And for things like root canals, obviously to be avoided, what's your feeling on root canals and the materials used and so on? Because it does seem quite intrusive.
Sure. And so root canals done 20 years ago, you got to get them redone. The main reason is because they were not done really well. And remember we talked about the different specific bacteria, they weren't able to be cleaned out 100%. So root canals done, many eons ago, definitely a huge concern. Second person root canals are a big concern is for somebody who has a high genetic risk. So, in my practice, like I said, I test everyone. So we look at if you have a high genetic risk for inflammation. For those patients, I don't recommend root canals. But if you're, healthy, no problem, I do recommend root canals. They're recommended with a specific endodontist, root canal specialist who uses microscopes and who uses lasers that eradicate any bacteria so that way you don't have a foci of infection. The reason why root canals are bad is because they weren't being cleaned out 100%. And people who were not trained properly were doing root canals and doing a bad job at it. So you never want to go to a general dentist or do a root canal. You want to go to specific endodontist or root canal specialist to do it. And you want to make sure that they have, number one, a microscope. Number two, they use lasers to disinfect the tooth, and they disinfect it through several mechanisms. One is irrigation. So they'll irrigate it. Second is they also use a gas. The reason why a chlorine dioxide gas, the reason why that gas is so great is because that gas penetrates all the way down into the bone. If there's any sort of bugs or any sort of bacteria in there, it's going to disinfect it. So when that complete disinfection is done properly, then it's okay. But it's when that disinfection is not done properly that the things you read about and the things you hear about are because of that.
Yeah, all the horror stories. And in Ayurveda, we understand, the stages of life, and particularly post-menopause, that we're in this Vata stage of life where if Vata is aggravated, it has an inverse relationship with our bone density. And that, of course, affects our teeth as well. And so what do we have to be aware of as we age, and particularly the stage where for women where we're going through lots of changes hormonally, perimenopause and menopause and then postmenopause? Is there anything that we should need to be aware of?
Absolutely. So I always say there's things, especially 40s, 50s, 60s, 70s, you really need to be really critical of. And especially when it comes to the mouth. The reason I say start at 40 is because that's usually when sleep apnea or, sleep disturbances actually start. And we don't just talk about menopause, we talk about perimenopause. The reason we want to start in our 40s is because, some patients actually, or some people end up, menopausal earlier than others. So there's usually a 10-year gap in between, right? So, and especially we're seeing menopause start earlier and earlier and earlier is because, number one, the use of contraceptives as adults, and then also the quality of our food. There's so many genetically modified ingredients in there that it has created internal havoc on our systems, and the hormones are not as balanced as they used to be, 200, 300, 400 years ago. So number one, 40s, we start with oral microbiome testing. We start looking at sleep studies. I also recommend going every 3 months for cleanings and making sure that bacteria is being removed, because as the menopause is starting to occur, it's going to activate more bacteria to grow than others. So we want to make sure that starts being taken care of. Dry mouth starts occurring, and especially by 50s, the dry mouth is pretty active, and at 60s is even worse because salivary glands stop, working as much. So that's a reason why. So that's a huge concern. So that's what we want to look at in 40s, 50s, and 60s. The other things that we want to look at is going to be vitamins and minerals, because vitamin D is really important. Most women are deficient in vitamin D. And so if we start making sure that we're looking at vitamin D, B12, and B50, making sure that's in balance, because again, everything that we need for those hormones is going to be a vitamin D precursor, right? Vitamin D is what breaks down into all these different hormones.
Okay, wonderful.
Yeah. And especially we're worried about, osteoporosis and things like that, and so that bone density is, super important. So 40s, definitely, weight training for sure, deep breathing for sure, Tai Chi for sure. All of these things make a huge impact, and really making sure that we're doing a lot. Our diet needs to change as well. So less sugar, less, carbs, but more greens, because leafy greens is where you get your nitric oxide from. Great. So green smoothie every single day, nitric oxide helps you fight heart attack, diabetes, cancer, all of these things that we're worried about, right? So those are really great ways to be able to really look at, menopause. And I actually don't say just women with menopause. I always say menopause too, because when men go through changes too, it's the same things, really looking at the same kind of basic foundational ingredients, which is high nitric oxide, making sure all microbiome's clean, making sure there's good vitamins and minerals, and making sure there's good sleep.
Wonderful. Great. Thank you. So I'd love to know, you have touched on the testing that you do. What is your protocol? How do you start with a new patient? What's the testing you're doing? Obviously, it's going to be specific at some point to the patient, but if you tell me a little bit about your approach, that'd be great.
Sure. Absolutely. And it's actually really great, Colette. We actually see patients virtually too. We have patients from all over the world, which has been really awesome, because they're really seeking this information out and they're really wanting to be served. So if, let's say you and I were going to work together, or you walked into the office, the first thing we would do is number one is going to be a really thorough background check. Tell me all your concerns. Tell me, what your body systems are. Are you firstborn, secondborn, thirdborn, fourthborn? Because that's going to tell me what your vitamin D levels are going to be like. I want to know if you have history of braces. I want to know when was the last time you went to the dentist, of course. What's your history like with cavities? Have you had any implants? Have you had any teeth extractions? Have you had any teeth breakages? All of these things are going to tell me what's going on. And then we would start with, look inside the mouth first, right? I always like to I don't just say, hey, you need a microbiological testing no matter what. I like to say, okay, let's look at it. Let me give you reasons why I recommend it. So we would take a look inside your mouth. We would look for, any bleeding in the mouth. I would actually smell. A lot of times I can smell pathogenic bacteria on the patient, especially the ones that come from a dry mouth. I will smell that. We'll be combining all of that information with their thorough medical history. If they're taking minerals, herbs, herbs, pharmaceuticals, as we talked about, anti-anxiety medications, just a lot of different things that people may be taking. We want to take a look at that and tie it together. So it's customized care. It's personalized and customized. So then we would look inside the mouth and say, these are the testing I recommend based upon what I see. Right. And it may be, hey, let's just do a spit test. It may be, let's do a spit, a oral microbiome test. Let's check your genetic risk for inflammation. Let's also, maybe check your mercury levels. Let's also maybe check, risk for heart attacks. Let's maybe check for, your ApoE gene, that you have. If you have ApoE4, making sure if you're at higher risk for Alzheimer's, just really different things that you may need. Then once the results come back, then we customize all of our care based upon what we see. We're going to talk about dental needs. We're also going to talk about, vitamins, minerals. We may talk about appliances that you need for your mouth to expand or 3D expand your sinus cavity, activating stem cells. We may talk about a multiple different modalities, but the main focus is we want to put out the fires, fight the disease. And secondly, we really want to put you on a path to prevention and health, and a path to healthy aging.
Lovely. Such a wonderful holistic approach. Do you feel like this approach is growing within your practice of dentistry?
I would like to think so. I would like to do that. So what I'm doing is training other dentists and other hygienists to do what I do, because then, like I said, the world is my children. So I want to find more good stewards who can treat patients this way. And it's not on the insurance model where they just drill and fill and see you later, really looking down and really looking at what the concerns are and really looking at data and information to be able to serve and to be able to, give confidence in health, because, prevention is better than the cure.
Absolutely. Prevention is key. And as we finish up here, Dr. Patel, is there any other areas or anything else that we didn't touch on that you would like to highlight?
I feel like we did a great job with really talking about a lot of these things. I wish I had like a visual I could give you with all the different ways, because we really are connected in so many different ways. I like to look at the 30,000 feet up, which is oral microbiome, nose breathing, tongue position, also looking at D levels, B levels. Really looking at that, but there's so much more we can go into, especially as we look at meridians, we look at tongue ties. There's so many different things that we can go to that would be, customized for each person. But looking at, solutions, but number one goal that we want, my message for you, if you're listening here, is number one, ask questions, be reflective. Don't just do dentistry because somebody told you so. Really start looking at how can I look at the root cause and how can I make sure that I'm in charge of, or I'm the CEO of my health. I want to be my CEO. I want to look at what can I do to make sure, and seek out practitioners. You can always call my office. You can always call us online. We're happy to help in any way. We have drnammypatel.com, Dr. Dr. and then NAMMYPATEL.com. I actually have courses I've designed, which goes through this stuff in detail, actually. Or you can purchase those courses and you can take those courses and learn more. If you want to do an oral microbiome test, just looking at your specific gene components, we can do that virtually as well. Right. Just, give us a call or shoot us an email and we can set up a consultation and then also help you be treated. Even I have patients in Malaysia, I have patients in France, I have patients in England, Switzerland and Thailand. We have a protocol that we have in order to make sure that the patients are taken care of in a proper way and without toxic chemicals and without detrimental side effects. So we can really take care of you Ayurvedically, holistically, and the way you deserve.
Wonderful.
You deserve to figure out the root causes. You deserve to be given the best care possible, and you deserve amazing results.
It's wonderful to see this really holistic approach and the empowerment of the client as well. Like you said, be the CEO of your own healthcare and really understand what's going on so that you'll make better decisions, right? To prevent any imbalances. So Dr. Patel, I just really appreciate the work you're doing in the world. I really enjoyed this conversation and thank you so much for taking the time out to chat with me today. And I wish you all the best on your endeavors as you spread your dharma around the world. It's really wonderful work you're doing.
Thank you. I appreciate you. Thank you for saying that. And this is, I love it. I love it. I love
I
it. I
can
love it. I
see.
love it.
I can hear your passion. So it's great. And it's great that you're doing it on many levels, not only with your clients, one-to-one, but also you're training other dentists and you have an online, availability option as well for offerings. So I will put all those links in the show notes, but thank you again. I truly appreciate it.
My pleasure.
I hope you enjoyed that conversation with Dr. Patel, and please check out the show notes for the links mentioned. If you think that this episode will be helpful to family or friends, please share it with them so we can spread this wonderful wisdom of Ayurveda. And don't forget, I have that discounted group cleanse starting January 31st. I hope you can join us on that. If you haven't already subscribed or followed the podcast, please do so, and the new episodes will automatically download for you. And if you would like to rate and review the podcast, I would really appreciate that. You can find me on social media on Facebook under Elements Healing and Wellbeing, and on Instagram, my new page is Elements of Ayurveda Podcast. Wishing you all a happy and healthy holiday season. And until next time, take good care of yourself, be well, and bye for now. Slán go fóill.